Hi, everyone. I wanted to introduce you to Dr. Elson Haas, who's head of the Preventive Medical Center in Marin County. Did I get that name right?
Yep, that's good.
All right, perfect. So I'm so excited to share his wisdom with everyone today, not only about the virus and what his take is on that and how we can all stay healthier and how to build up our immune systems, but also his interest in astrology and medicine. So can you start by just telling everybody a little bit about what you do out there in Marin County and why you're so interested in astrology?
Right. Well, I was in medical school. Hello, everyone. And in 1968 to 72, I grew up in Michigan and Detroit and went to University of Michigan. And, it was a time when the times they were changing, So I was in medical school. I was like already kind of a little bit of a radical medical student. I was working in the free clinic and doing talks and things like that already. And I just was studying about vitamin C and herbs. And I said, this is interesting stuff, And I got a book a friend of mine had called Medical Astrology by Omar Garrison. And I already had my chart, was done in 1969. And I was like, oh, this is pretty cool stuff, And over the course of my career, I've always looked at that. And even in my first book, Staying Healthy with the Seasons, that I wrote in the late 70s, as I was, all through the 70s, I was saying, I want to study about health and healing. So I did a juice cleanse and my body changed, my allergies cleared up. I felt healthy and vital. And I was in my 20s and, I should have been already healthy. But I didn't, I hadn't learned much about health and healing in medical school. But I really started to get fascinated with traditional Chinese medicine also, and the cycles of life, cycles of nature, and the seasons and the daily cycles. And astrology is based on cycles. It's looking at the planetary bodies and the effects they have on us. And I've had lots of ideas and theories that we can share at a later time, but just even the effects of the elements and the metals in the earth and how those patterns are affected by the celestial movements, let's say. So I've always had a celestial calendar on my wall. I'm always looking at the moon. I studied and worked with Dane Rudyard, and I read his book called The Lunation Cycle way back in the 70s, and it's just like, wow, this is how my creativity. And I realized, tuned in, that new moon was a stressful time. I would overeat and I would block my energy. And I started to do a 3-day cleanse every new moon. And that's when I started to write, because instead of stuffing things back inside, I started to bring things up. And it really energized my creative force. So one of the things I'm going to be teaching on in metaphysical or evolutionary medicine in this coming year is to really have people tune into the new moon, full moon cycle, and the creativity that we can do in all aspects of our lives. And to me, that's really a valuable thing, if we can really take charge of our life.
Can you explain to people who don't know much about astrology why you think astrology has a basis of science to it? I mean, I always explain it that the moon is a rock in space and it regulates every body of water, and we're like 80-90% water. But it's an esoteric science. I always tell people it's not a hard science, but there's some correlation, just as you described.
Well, it's an energy. I mean, I've had a lot of people when my book first came out, my Staying Healthy with the Seasons book, I had a whole section in the back on astrology and astrobiochemistry and the cell salts, and I was studying and working with all those things. It's a soft science. I mean, there's not a lot of data. There's not a lot of studies. But I think it's very similar to biorhythms almost. It's like we have these physical and emotional and mental cycles and all these other cycles. So, but when I was studying about it, there was already back 50 years ago almost, there was already a fair amount of documentation and books and really experts who looked at when your Jupiter control affects your liver, and if you have an adverse relationship there, maybe that stress you. I'm more into the bigger cycles, because I talk to people. Like, if I see, yesterday I saw a woman whose her whole life is changing, and she's 59 years old. I say, well, you're just finishing your second Saturn return. And, you know, in traditional Chinese medicine, I have this idea. I talk about the doyo in my book, the transition time. So we have these 10 days before and after each equinox and solstice, which are transitional times. And we also have the whole pattern of cycles. So the doyo. So anyway, so as we do our first 30-year cycle, you know, it's kind of, who are we? What do we like? What don't we like? What are we good at? And then we decide, what are our career years? You know, what do we do with that? How do we serve the world, and how do we get supported back? You know, because if you have a career, ideally you can take care of yourself and your family and all that. But the third cycle is the transition, where a lot of people retire, and if they haven't, you know, it's called, you know, I call it the destiny or spirit years. As we move into our 60s, you know, we have greater wisdom, we have greater gifts to give to our people. And so to me, that's an important time. So she was just, you know, I had one of my associates sitting in with me. It was on a Zoom call with somebody in Hawaii, you know, so she was like, yeah, I was like, that's where she was. And this is a woman that I've known for a long time. So I've watched her through her life changes and things. So, but it's cool to embrace that as part of health, you know, because, you know, so much of our health is in our own hands, and the more we take charge of it, and that's one of the things that I teach on my website. I have the 5 keys to staying healthy, you know, good nutrition, regular exercise, good sleep, managing stress, and learning how to deal with emotional upset, and attitude. And I work a lot with people with attitude. If I can get people to shift their attitude, Leslie, then we're making a big difference in how they take care of themselves. And, you know, after I did my first cleanse, my attitude changed to, well, this is the only body I have. I'm going to treat it with love. And when I did that, I said, okay, well, I'm going to eat better. I'm going to exercise more. I'm going to work on all these other aspects. So we really start taking care of ourselves. And, you know, I'm basically, you know, I call myself a barefoot doctor still, or a philosopher physician, because I want people to really embrace the whole approach to themselves. And we turn way too much power over to doctors, and we're given a lot more treatment and drugs than, you know, we need. And, you know, my motto in family practice is lifestyle first, natural therapies next, drugs last. So, but
that's not the order at the moment.
Yeah, but I still write a lot of prescriptions, because people are on prescriptions and they're using medicines. Can they change their habits and improve their lifestyle so that they can use less medicines? So I don't, you know, I'm a family doc, so I don't really think, oh, medicines are bad, don't use them. But we need to get results. So blood pressure is a common issue that, you know, a lot of people are overtreated, but a lot of people are undertreated also. So if people start to eat better and lose weight and get their stress down, their blood pressure will come down, then they can use less medicine. So we don't just take medicines away, we improve the health so that less medicines are needed to get the results that we need.
What about the rise of all these autoimmune diseases? It's an epidemic. I have so many friends right now, either Lyme's disease or autoimmune diseases, and it's a really serious problem.
That's true. Well, it's all allergy. This is one of my more recent books called Ultimate Immunity. You know, so there's a whole section, and I look at people. I use the basis. You know, part of what am I doing? I call new medicine. The NEW stands for Natural, Eastern, and Western. So my approach has always been to integrate these systems, because they all have value and they all have weaknesses. You know, so if people are acutely ill, you know, Western medicine is really stellar. You know, if you're injured or things like that. If you want to support your body in more subtle balancing, traditional Chinese medicine is great. Natural medicine is something we all should do every day, you know, and, you know, using various herbs or getting on the right program. Almost all of my patients are on some combination, and everybody's unique because nobody does the same thing. Some kind of diet, some supplements, and some medicines. And to put those together in a way that works for them is really, you know, to me, the art of medicine.
All right, there are not that many doctors like you, maybe in California, but where I live in Florida, we can't find people like you. So what do you advise people who don't live in California?
Well, that's why we're, you know, COVID is a gift in some way. I've been teaching on Zoom online for the last 2 or 3 years. So I normally teach a cleanse every spring, but when COVID hit, like that was starting March 21st, instead of that, I said, let's change this. I ended up doing a 7-week course to all the people that had signed up on immune support and spring health. So my whole message during this time, and I still want to come back to your question about autoimmunity, because maybe I'll take that right now for a second. We live in a toxic world. When I have in my new medicine book, I have a chapter called Understanding Diseases. I just did a talk. Anybody who signs up for my newsletter, I just did a talk the other day on understanding causes and on new medicine. So in the center, to me, the basis of good health is cell health, okay? The problems that cause the cells to be imbalanced are deficiency of all the nutrients we need, vitamins, minerals, amino acids, fatty acids, phytonutrients that come from fresh living foods. And the other side is toxicity, chemicals and metals, even electromagnetic energies that affect our air, food, and water, or that we put on our skin or treat our hair with and all that. Deficiency and toxicity interfere with optimal function. That can lead, and that imbalance is based on the choices we make every day. That imbalance can lead to inflammation, immune dysfunction, metabolic disturbance, infections. Those are secondary causes, I call that. And then all the other things like high blood pressure, diabetes, allergies, arthritis, etc. Those are tertiary. Those are the result of these other imbalances. So when we're really trying to work on healing, which has been my goal since the beginning, like for almost 50 years in practice, when we're looking at healing, we're saying, how do we heal the cell to start with? And that's why if we just did on a national basis, everybody clean up their diet and do a little detox, get off excessive amount of food, fried foods, sugar, caffeine, alcohol, wheat, dairy, etc. Take a break from those. Let's see how your body feels. Make sure you're getting all the nutrients you need in, lots of veggies, good protein, good oils. Half of people's problems would go away, right, or greatly reduces. And this is what an integrated approach in in a way to prevent or reduce high blood pressure, diabetes, high cholesterol, heart disease, the things that are, basically killing people as we age, because we're all living longer, but we have more chronic problems. So that's why healthcare is so expensive. But the autoimmunity comes a bit from the toxicity and self-attack. If you look at the deficiency toxicity balance in terms of immune system, when our immune system is weaker, we get sick more easily. The outside germs can penetrate our body. If we want to protect ourselves, we start with healthy cells and tissues, and we also start with our mind. I surround myself in light every day because I'm exposed to people and all that. And if we really keep our vibration strong and our sleep, and that comes from good sleep and all that, we are more protected. So, during my class, we were doing guided imagery sessions. We were having people, see the golden light around them and purifying anything that comes into you. That's one level. But, to me, what's going on your inner body and giving yourself the nutrients you need to help protect. So I have kind of a detox and nutritional support program to reduce autoimmunity. The autoimmune is more, an allergy and autoimmunity are more a hyperactive immunity, they're excessive reactivity, whereas deficiency leads to more vulnerable, infections. So those, to me, that's a simple way to, I like to simplify things. That's when I wrote Staying Healthy with the Season, it was all like, I'm studying nutrition and Chinese medicine and mind, body, and exercise, and and all that.
It's a great one. Andrew Weil, is it Weil or Weil? He said one of the classics in the field of integrative medicine. Yeah. You guys definitely should get that book.
So I am starting on September 12th. I am starting a year-long course, season by season, for people who want to really follow that. We'll have several sessions a season. That'll include some detox programs and all that. So I'm going to be doing that as a course because people are home. People need the support, and the more you take care of yourself, the less you need outside doctors. And I think at this time we do want to keep people off the streets, out of hospitals, out of clinics as much as we can. And so that's why it's a good opportunity to kind of support yourself. And in each season I go into things, I talk about energy a lot because it's kind of partly understanding traditional Chinese medicine from a Western mind, I talk about colors and chakras and, less astrology. I had astrology when I first wrote it. And I was studying what I call astrobiochemistry, which is the 12 cell salts as it relates to the signs of the zodiac. And
Wow.
when you had, I was watching cycles daily, and when you had a stress, if your moon and Mercury were stressed, you do that. But more if it was a sign, like if I'm a Leo and with moon in Cancer and Libra rising, so I have this kind of masculine, feminine, balance, and I like things peaceful around me, So to me, it's just been valuable to have that information, and the other aspect is more the energy part. I mean, I call it metaphysical medicine or evolutionary medicine, where we're really addressing the mind, body, spirit. Besides it's not just physical, it's emotional. So I'm going to actually be doing a free talk on August 22nd on metaphysical medicine, and really looking at it. I'm going to talk about the creativity and moon and earth cycles and all that. So to me, astrology is more just like it is. It's astronomy, basically, and the effects of the movement of the planet. So if we believe in gravity, if we
Right.
believe in force, then we can't not believe that everything going on around us. Yeah, I mean, Pluto, that's small and millions of miles away. I mean, how much impact does that have versus the moon? The moon, I think, is our close planet, or so, hey, our close body, let's say. So,
Well, I tell everybody that I'm about 95% accurate with understanding a human being's wiring system, which is why I'm so interested working with doctors, because if I can tell a doctor what's really going on at a soul level, I'm not a doctor, but I can see imbalances, and it can sometimes say just the right thing to a doctor so that they can help the person with something that they weren't able to figure out before. One client in particular, 6 years of chronic pain, and the doctor couldn't help her, and he said, Leslie, you got to take a look at this. And I knew in 1 hour what the problem was, and she's finally pain-free and doing well. So
but you can say, you sense more from the astrological movement what organs might be affected or what stresses around the body. Is that where
I'm not really good about sometimes the organs a bit, but I guess my area of expertise is trauma, and I can see imbalances in the elements.
Psychoemotional trauma?
Yes.
Yeah.
And I totally believe if you've had trauma under the age of 5, you're going to have a really PTSD kind of personality. And a lot of times that goes untreated because nobody understands. If you go under anesthesia under the age of 5, you come out of that hospital and you're not quite the same as other little children. And a lot of people don't talk about this, and there are a lot of walking wounded people who are adults.
It's interesting. It's interesting, Leslie. Even when I was a medical student and I was in the hospitals, my mentors were saying, I take time with people. It's like, but I saw that when people were sick and you interviewed them about their lives were sick too, in a sense. They had a lot more trauma and drama, I called it, in their lives. And when you see people who have that, and you see them, they have a multiple list of medical conditions and medicines they take, their lives haven't been rosy. They didn't grow up in a well-established home and had support and love and all that. And I write a fair amount about that in my Staying Healthy with New Medicine book. My most recent book is the whole dealing with the psychoemotional healing that allows your body to heal. And but we still need to start now. I've been saying for years, my friend of mine said, his grandma always said, don't correct your past, correct your future. So start now and start living in a way, and you can heal. I mean, I have a lot of people who do hypnotherapy, where you go in and you say, when did this, what was the trauma? When did that start? And, how can I bring that forward? How do you uproot those, those weeds basically in your psyche? I mean, I look
at them as like, remember when we had record players and the needle would get stuck in the groove, you'd hear the same song over and over again. Talk therapy is like talking about the needle in the groove. And I'm a big believer in EMDR therapy, where you actually go into the brain and you can shift it. And I think a lot of people I think this virus is making people very traumatized and stressed out. And
It
so let's
is.
talk a little bit about what do you think about this virus? How long do you think it's going to be around? Do you believe in taking the vaccine when it comes out? I know that's a tough question.
I thought it was going to be easier flowing out of it. It's not, you know, I mean, even though there's very few cases in Northern California where I live, I mean, relatively, but
Right.
there's people, and everybody who's got a symptom is calling up my office and saying, should I get tested now? I have this and that. And so far, as I said, I haven't had a positive. You know, I think, yeah, there's a part of me that's concerned about, you know, I write a lot about peace and medicine and war, you know, warfare. I mean, this article that I'm about to publish called, it's probably called First Do No Harm, but it's From Politics, Medicine, and War to Integrity, Healing, and Peace. And it's about how we are conflicted, how we fight disease, how we, you know, kill germs, how we do all that, how we take an attack and a conquer approach in politics, in medicine. We, you know, we fight with the body, and that the battleground is a place that suffers. You know, if when there's a war somewhere, you look at what happens to the communities and the buildings and everything, it's a mess, you know. And we do that in agriculture, we do that in food production.
Right.
I want people to kind of take a little different approach. We need to learn how to harmonize in those areas. And so to me, that's my belief. I've been kind of a peacenik since, you know.
But who's leading the charge for that right now? We don't have a public figure who's really talking about this.
So we have, you know, you know, when I ask people what their stresses are when they come in to see me, Trump was number one, you know, or politics was number one. Now it's COVID and, you know, and the government all together. And we have a very much an embattled system. We have an embattled political state right now that's led by a president that's, you know, rather childish and rather, you know, just very self-aggrandizing. Some of my friends call him a pathological narcissist, but, you know, I don't like to call people names, but, you know, it's just concerning that we have somebody who's not really trying to find peace in various things or how to harmonize, where, you know, they're just they like stirring up stuff. So, you know, I don't appreciate that. And I don't think it's a wise way to go. And it's very stressful for our country and all the people in it. And so we need, you know, we need change from that. We need a place where we all start working together. But, you know, there's concern. There's a lot of concern about the war that's happening amongst people now. We talked before we got on about the mass debater, and John Oliver had this whole thing about everybody saying mass debate and masturbate. It's like we're masturbating over the mass debate. You know, it's like, you know, we're obsessed with that. And, you know, I just wrote in my newsletter that's going out, you know, in a couple of days, that, you know, I think, you know, I wear a mask when I'm seeing patients in the office. Most of my staff we're all practicing some social distancing. But to me, you know, kindness and love are supportive. And if you're around people that are asking us to wear a mask, because I'm pretty certain it is protective at some level, we should just be accommodating. As you know, to me, I learned when I was 7 years old that, you know, we should be able to have freedoms to do what we want to do as long as we're not hurting somebody else, you know. And so wearing a mask is, you know, it's not always comfortable, but I think, you know, it was a wise thing to do currently until we figure other things out.
Do you think we're going to have a vaccine?
Well, vaccine is that's a whole discussion unto itself, with just that. I don't trust the government and supplying us with things that they're willy-nilly kind of releasing. I mean, that's true for chemicals that are in use and for food additives and medicines as well. So I like things to be tested first before I start suggesting them or using them. So I think we're going to be a while before we have a vaccine, and we don't even know, you know, it's going to take longer to even find out if it really works, you know, because if you have somebody wanting to come visit, like my son just back from Nepal and is working there, and his girlfriend, you know, is in a community that's COVID epidemic, basically in southern Texas, you know, and she may come visit. Now, would she have to You know, my son just got back. He was 2 weeks in my backyard in my teepee, you know, living, and I was feeding him 3 meals a day, and I was kind of staying away from my office for a bit, you know, and we got tested and we're okay, and he's okay. But if somebody had been exposed or has had it, and a month later, can they be around other people who haven't? So that, you know, that's something that hasn't been well tested yet. Like, is that person kind of immune or not immune? And it may be individual. So, I mean, there's so many questions we don't know. So when we don't know things, it's always good to kind of be a little bit cautious. You know, I mean, you know, I'm kind of a self-preservation kind of person, you know. I have friends who study the Enneagram, you know, and so.
What number are you?
What's that?
What number are you in Enneagram?
Oh, 9. I'm a self-pres 9.
Oh.
I hear. But
That's
that's a system that I don't really know that well. It seems like you just have patterns. But, you know, it's no different. It's kind of no different than saying, oh, you're, you know, a Gemini with a Virgo moon. So that's going to give you certain qualities that maybe are different than somebody with a Leo and a Cancer moon. So anyway, so, you know, we're just all learning. I mean, we're here in life. To me, the goal in life is to learn and evolve. And when I look at health and healing that way, is that disease is conflict. You know, it's at multiple levels, at every level. I used to say people when I was working on bodies and, you know, positive imagery, you know, when we're unwell, it's happening at every level of our being. And the more we work on that healing, we have to work on all those levels. And so to me, it's really important that we kind of bring ourselves forward in that way, and just, you know, kind of respect ourselves, honor ourselves, and you know, take good care of ourselves and those around us. So, you know, that has to do with our
people don't know how to do it. They literally are pretty ignorant about nutrition, and
right.
You know, in California, it's like a different planet compared to Florida or other places.
Yeah, that's true. Yeah.
Not as advanced in that area. 2 last questions for you. If you were to suggest a couple of supplements or a couple of easy things people could do right now to just protect themselves from the virus, is there anything that you would suggest?
Yeah, I think the key nutrients that support your immune system are vitamin A, D, B complex, C. C is probably there. Zinc, you know, selenium sometimes, but you know, so basically vitamin D.
How many milligrams of vitamin D do you suggest a day?
Vitamin D, I have, you know, usually 2,000 to 5,000 IUs, international units. Vitamin A could be 10,000 a day.
Okay.
True vitamin A. And
what does that mean? What is true vitamin A?
In other words, not beta carotene. You want, but you know, vitamin A more directly. Vitamin A, palmitate or fish oil, okay. And then zinc, probably 25 to 15 milligrams a day. C, vitamin C. Like if I started to get sick, I would do vitamin C almost every hour, 500 to
500,000 every hour.
Yeah,
Okay.
Or I do fresh garlic. I'll chew up garlic. I'll stick, you know, garlic in a little honey and just gonna chew it up a little bit. But I have had people, you know, and you could do, you could do things locally. Who does it?
Like what? What do you think locally?
Well, I mean, if you start to get a sore throat or something, you could do like I'll take oregano oil a little bit and drop it in. I'll put like water and drop a couple drops in it and slosh it around. And you could even use a little alcohol for that. You can use a little shot of tequila, or because it, you know you want to kill things locally in your throat. So you know, and alcohol. And that's why we're using you know, rubbing alcohol, isopropyl alcohol, to clean surfaces and clean hands and all that stuff, because it does kill most germs.
Is that the same as isopropyl alcohol?
Yes. Yeah.
Okay. And one last question. If somebody who's listening to this would like to work with you and make you their doctor, can you do that from a distance? Are you allowed to?
Well, I can do certain things. Like one of the things I'm starting, and I just actually recorded some videos the other day. I'm doing a program called Personal Health Journey, where I would interact with people. I have questionnaires they fill out. We would do a Zoom visit like you and I are doing. We review everything. We look at their goals. We look at all their lifestyle thing. I can't do medical care like that. In other words, I can't prescribe, but I can usually typically say, I want you to go see your doctor and get these tests done and ask for this and do that.
So you can't prescribe anything for somebody?
No, I actually have to see somebody as a patient. I mean, right now telemedicine is happening, so I could see people, but I don't know about cross state lines. I have a California medical license. I don't have a U.S. medical license. There's no such thing. There should be, though, at some point. So I have a personal health journey. It's an add-on to my seasonal long program, and also to one of the programs that's starting in 2021 on evolutionary medicine, where we're really talking about how do we evolve our health, how do we use illness as a path toward healing. And that's, to me, the message. That's the kind of the conclusion of my Staying Healthy with the Seasons book about, disease represents conflict, and healing has to do with our own growth and evolution, and, to recover and rebalance from, the lives that we had. A lot of times that's just correcting how we're living, basically.
Right. If there's somebody listening to this right now and they want to learn how to do this as a profession, do you train people in this and certify them if they're not doctors? They like coaches?
I could do it as, as we're not really. I mean, I'm training people in the sense of understanding all the aspects of staying healthy with the seasons and new medicine and all that. I do have, I've had a lot of nurse practitioners, not med students, residents come sit in with me and work with me for a month or so, in my clinic. And so, a lot of that's passed on, and then some of them end up working with me, over time, but I've done that a lot. I do some classes for nurses.
That's interesting.
Yeah, because nurses really embrace the idea, of healing and caring for the body and everything. I've been teaching nurses. Actually, one of my fun things I did after Staying Healthy with the Seasons came out in 1980, it came out in 81. So in 1984, I took a group of nurses to China, and we went to all these different clinics and, barefoot doctors, and it was just an incredible trip, and so I've been doing work with nurses over the years. So, but my website is my name, elsonhaasmd.com, and my clinic is pmcmarin.com. But so there's a lot. I have a lot of educational things on my website, a lot of articles, a lot of blogs. I have a number of programs that people can do. You can guide yourself with me in classes, doing a cleanse or a detox program. I did my whole immune support, spring health. I have a free program on there called 5 Keys to Staying Healthy, where you can review your own personal lifestyle. And that's part of what we use for my personal health journey with people. So, but I would work with people anywhere and have them be supported by their current medical support team. And there are a lot more people. There's very few doctors doing what I do, taking insurance and Medicare, which is something I do.
Wow. Well, I may know people who would actually be willing to fly out there to see you.
Yeah, well, I've seen people all over, and plus my sister lives in Tallahassee, so I just was with her right before COVID hit, so I was up there and looking at going hiking and bird watching with her and everything. So
nice. Yeah. Well, one other thing I just wanted to tell you is that I at one point was thinking of calling myself the Barefoot Astrologer.
Mm-hmm.
And I used to live on Barefoot Place in Vero Beach, Florida.
Oh, yeah.
So in fact, you call yourself the Barefoot Doctor. There's no accident that we've met, and we're going to have another discussion about astrology more in depth. But for this first little chat, I'm so excited that we were able to do this, and we're going to be in touch.
Thank you.
Thank you so much. I really appreciate it.
Here's my new line is, besides calling myself a baby zoomer, I say namaste healthy.
Oh, I like that.
Then my friends would say namaste home, namaste safe.
Yeah, that's good. That's a good way to end on a laugh. Thank you so much.